How has colonoscopy prep changed over time? Imagine a time when preparing for a colonoscopy meant days of strict dieting, multiple enemas, and drinking large and pleasant solutions. That was the reality in the early days. Patients had to follow restrictive diets for 2 to 3 days before the procedure, often consuming only clear liquids or low-residue foods. They would then take strong laxatives and sometimes enemas on the day of the exam. These methods were not only uncomfortable but also sometimes caused fluid and electrolyte imbalances, making the process quite burdensome. As medical understanding improved, so did the preparation protocols. The invention of the flexible fiber-optic colonoscope in the late 1960s was a breakthrough, allowing doctors to see the entire colon. But the prep methods remained challenging for many years. Over time, researchers and doctors developed better bowel cleansing agents and more patient-friendly routines. Now, instead of days of restrictions, patients usually start a low-fiber or low-residue diet just a few days before the procedure. Often, they only need to follow a clear liquid diet the day before. One of the biggest advancements has been the adoption of split-dose bowel preparation. This means patients take part of the laxative the evening before and the rest a few hours before the colonoscopy. This approach results in a cleaner colon and is generally better tolerated. The most common laxatives used today are polyethylene glycol solutions, which are effective and safer than older options like sodium phosphate. These solutions are designed to cause minimal electrolyte disturbances and are easier to drink. Sometimes, doctors add medications like simethicone to reduce bubbles and improve visualization during the procedure. Medical guidelines now recommend these split-dose, low-volume regimens to ensure the best possible cleaning. They also suggest personalized approaches for patients who might have difficulty with standard prep, such as those with certain health conditions or previous poor preparations. Overall, colonoscopy preparation has become much more manageable. It has shifted from long, restrictive routines to shorter, more tolerable, and more effective protocols. These improvements help doctors see the colon more clearly, which is crucial for detecting early signs of colorectal cancer and preventing serious health problems. Always remember, it's important to follow your healthcare provider's instructions for prep and discuss any concerns with them to ensure a safe and successful procedure.